Let's go over this one more time. The path of blood flow. So we're going to start with blood here in the right atrium. From the right atrium, it's going to go into the right ventricle, and then it's going to go out through the pulmonary trunk into the pulmonary arteries. I want to make one point at this moment. I want you to remember that blood never goes from any chamber on the right side of the heart directly into any chamber on the left side of the heart. Okay? Um, if you're looking at a multiple choice question and answer thing and it says from the right ventricle into the left atrium or something like that, it never goes from the right side to the left side. Why not? Because right here in the middle is the interventricular septum, so they don't connect. So from the right atrium down into the right ventricle, out the right ventricle through the pulmonary trunk, and it's sending the blood out to the lungs. The lungs are going to allow that blood to pick up oxygen, drop off that bad old CO2 before heading back to the heart. So pulmonary arteries are blue. They're low in oxygen, high in CO2. Picks up lots of oxygen, drops off the nasty CO2, comes back beautiful and red in the pulmonary veins. Number 5, pulmonary veins. And then it goes into the left atrium, from the left atrium into the left ventricle. Out the left ventricle through the aorta, drops off all of that wonderful oxygen, picks up the nasty old CO2, brings that back either through the superior vena cava or the inferior vena cava, or back in the right atrium. And remember that you're going to need to also add on to that the different valves. So between the exit door to the right atrium is what? The tricuspid valve. The exit door for the right ventricle is the pulmonary valve. Come around here, the exit door for the left atrium is the bicuspid valve, also called mitral, M-I-T-R-A-L. And the exit door for the left ventricle is the aorta. And these are one-way doors. Great. So now let's look at a little bit more at the coronary blood vessels. You know, your heart is filled, it's got chambers inside of it that are filled with blood. And even though there's lots of oxygen in the blood that's inside the heart, it will not keep your heart alive. Your heart cannot live off of the oxygen that's found inside of the atrium or the ventricle. It has to have its own blood supply, and that blood supply comes from coronary arteries. So here is the exit of the aorta. So blood just recently was in the left ventricle, now it's in the aorta. I want you to notice that a little chunk of the pulmonary trunk got cut away so that we can see the origin, the beginning of the left coronary artery. So humans have got 2 main coronary arteries, and then they branch from there. Here's the left coronary artery, there's the right coronary artery. Blood vessels that you see on the surface of the heart, the red ones are arteries, coronary arteries, and the blue ones are veins, and they're usually called cardiac veins. I do not know why. Like, why not make them all cardiac or all coronary? I don't know why. Okay. Now we're looking at the back side of the heart. And again, the red blood vessels would be coronary arteries, the blue blood vessels would be cardiac veins. I want you to notice this big bulgy area right here in the middle of the back of the coronary veins. That bulgy area has got a special name. It is called the coronary sinus. And the coronary sinus gathers up the venous blood and then drops it off into the right atrium, where blood from this is the superior vena cava and the inferior vena cava, that's being dropped off into the right atrium too. A little bit about blood pressure. So blood pressure is the force that blood exerts against a vessel wall. So if this is a hose of some kind, maybe this is one of your arteries, if there's a lot of pressure inside of it, oh, it really stretches the artery. And if there's just a little bit of pressure inside of it, it only stretches the artery wall a little bit. We generally measure a person's blood pressure right here at the brachial artery. Yeah, biceps brachii, right? Brachialis, the brachial artery of the arm. But you don't have to. You could measure the blood pressure at the leg if you needed to, right? I want you to know the difference between systolic pressure and diastolic pressure. Systolic pressure is the pressure that we measure in our arteries when your ventricles are undergoing systole, okay? Ventricular systole is when the ventricles are contracting and pushing out a big spurt of blood. During ventricular systole, your blood pressure goes up, and then when the ventricles are regrouping during diastole, when they're regrouping, then your blood pressure goes down. Blood pressure goes up, blood pressure goes down. Normal for a young adult would be like 120 over 75, or maybe, maybe for you it's 110 over 65, right? It is an important measurement of whether there is enough pressure to do the job blood needs to do, and whether there's too much pressure so that it's starting to damage the arteries and small blood vessels called arterioles. Okay, systolic, diastolic. Now, high blood pressure, I want you to memorize this number, 140 over 90. 140 over 90. That reminds me to tell you, everyone's blood pressure has got two numbers. If your aunt tells you that her blood pressure is 110, that doesn't mean anything, right? So blood pressure always has two numbers. The first number is the systolic number, and the second number is the diastolic number. The diastolic number is always second, and it's always lower. The first number is always the systolic number, and it's always the higher number. Systolic and diastolic. Everyone's blood pressure's got two numbers. If you've got blood pressure of 120 over 75, that's good. If you've got blood pressure of 140 over 75, you've got high blood pressure. If it's 125 over 90, you've got high blood pressure. High blood pressure is properly known as hypertension. Hypertension, and it does all kinds of damage, and we will be talking about that during our lectures. So the lectures that I point on the post on the lecture page of Canvas. Okay, make sure you remember that. That's one of those numbers that's going to be on an exam. All of the blood pressure readings, blood pressure goes up in these arteries when the ventricle is contracting, and then it goes down, then it goes up, and then it goes down. So when we say your blood pressure is 120 over 75, we mean that it goes up to 120 and then down to 75 with every beat of your heart. Okay, systolic, diastolic. Alrighty, you're not going to be taking blood pressure in your home unless you happen to have a stethoscope and blood pressure cuff. So I will say goodbye to you at this point and see you in the lectures.